select your preferred language.
In English from a smartphone, touch the three dots that say More, select Language Interpretation, and select English. Próxima. También estamos ofreciendo la presentación.
We are also offering the visual presentation today in both languages. So if you want to see the presentation in English, just click on the upper part of your screen and select visual options, and there you will be able to find the menu, and you will be able to have the option of the presentation in English or Spanish.
And click on View Options, a drop-down menu will appear and you can select the English option. También esta opción está disponible en smartphones.
This is also an option on your smartphone by using the three dots menu that says More.
On your smartphone by selecting the three dots that say More and selecting Language Interpretation in English. And you're going to be able to see the English presentation. Próximo. Ok, así que para los que no nos conocen.
So, well, for those who do not know us, we are here representing MCN, which is the Migrant Clinicians Network, and our mission is to create practical solutions at the intersection of vulnerability, migration, and health. And our vision is a world based on health, justice, and equity, where migration is never an impediment to well-being. And to achieve this, our work includes many areas in this field. Next slide, please. Part of what we do is right here in this slide. MCN is here to develop resources. We are also in education. For example, with a workshop like this one, to provide technical assistance, carry out research. We have specific program on cases handling, and we have many other roles and functions in our organization. So we are here for you, whatever you might need, and any help you will need. Next slide, please. Well, before we move on, we want to make an acknowledgement to the Thoracic Foundation for financing, making possible this space, and as well have made possible to develop the materials that we will be speaking about today. Next slide, please. And so, well, we already introduced ourselves. My name is Mireles Muñiz Marquez. I am the program manager for MCN for 5 years already. And it is a pleasure for me to be with you today. And we also have our colleague, our beloved colleague, Alma Galvan, who is the Director of Community Engagement and Worker Training. Okay. So what are we going to do in this hour that we have together? First of all, we will identify the major respiratory hazards associated with exposure to contaminated air. We will be exploring the use of free educational materials developed by MCN to support respiratory health education and prevention efforts. We will strengthen capacities that you already have in order to bring this information by using visuals and participative activities. And finally, we want to promote in this space strategies that are accessible prevention and self-care ones for the people you take care of. We want to now show to you these slides, this visual aid that is part of the materials we have today for you. This presentation you will be looking at, you will be able to download so that you can use it when you carry out your educational activities. And our topic of this presentation today is nobody knows we breathe until we run out of it, protecting our health from bad air. Clear the air. This presentation, as I was saying, is one of the resources and it has several resources to complete it that are inspired in a comic. And we are trying to facilitate and make it easier. This is the information on how to protect our respiratory health before air pollutants. And what we will be covering right now, you will get it at the end of this presentation. So we hope you like it. And we're here for your comments, recommendations on the chat. We're open for that. So we will get started right away. How to start a conversation having to do with polluted air? Well, we know this is a matter that we're undergoing nowadays. And as I am in the Caribbean, we are currently facing a lot of problems with the Saharan dust. We are in peak season receiving a lot of this dust that affects the quality air in Puerto Rico, the Caribbean, and will continue to move on to other countries. So that's why it is so important to speak about this topic. Another important matter is that we are getting into summer. So heat is also something that is present in the environment. And it is extremely important to keep in mind, under these circumstances we're in, everybody who works outdoors, because as they are outdoors carrying out an activity or a job, even ourselves, if we are during a long time out of our homes in this kind of weather where it is so much heat and the air is not of the best quality, we can be affected. So we need to know how it affects us, why, and how to protect ourselves most of all. So let's imagine that we are outdoors workers and we're outdoors, and by this we mean like agricultural workers or people who work maybe in a factory or another space, for example, construction, and they need to be constantly outdoors. They are not under a structure with air conditioning, but they are exposed to the environment surrounding them the whole time. So just imagine to be in such a scenario. When it is so hot, our body knows. It notices it because we start sweating, we feel tired, and our body starts sending signals. So heat even starts affecting what we are doing, the way we work, and unfortunately also how we live. Heat excess may be really dangerous. And one of these things that heat also make us feel is a difficulty when we breathe. Next slide. We need to ask ourselves why. What is going on when there's so much heat in our environment so that it's so difficult for us to breathe? And heat itself and the way it affects our body while we are carrying out an activity outdoors also has to do with when it is so much heat, extreme heat, pollution in the air tends to go up. And then this makes it more difficult for us to get the oxygen we actually need. So we need to start thinking about a scenario like this when we are trying to reach the people in our community or patients of our center. We can start our conversation on how the heat has been affecting them at work, at home. We can also ask if they have noticed that when the heat is high, if there's people surrounding them who feel tired, who feel bad, if they have someone with asthma near, what happens? if there's a change in the environment, when there's a lot of heat, or when pollution on the air is too high. These are different strategies on how we can start out with this conversation. Next slide, please. In the materials that we will be sharing, this icebreaker that we have that is to affirm that when heat and pollution in the air are happening at the same time, it can be dangerous if they are combined because it will be affecting our breathing. But we want you to have the opportunity of delving into detail on how or why our respiratory health can be actually affected when we are in heating and polluted environments. One of the recommendations that we have is that you can talk about ozone, for example, which is this pollutant that can affect the lungs when you breathe it in when it is high, and it is related to high temperature. Now we're actually heading towards summer, so it's important to speak about this. When temperature goes up, levels of ozone in the environment also raise. So we will get to see some symptoms such as throat, chest pressure, which can be symptoms that air pollution is affecting people and can make their work and life to become more difficult. Those who are exposed to high ozone levels can experience symptoms like shortness of breath, headaches, dizziness. Those who work near traffic, industrial sites, or where chemicals are sprayed may be at higher risk when exposed to this polluted air. So to answer the question on how our health is affected by the air we breathe, we need to start speaking about something we do every second of the day, which is breathing. Normally we don't think about it, but the air we breathe plays a huge role in how our bodies function. So let's move to the next slide in order to explore a little bit about how we breathe and how these mechanisms work. Here we see this image where we are trying to show what happens when we breathe. Our lungs are designed to take in oxygen from the air and send it into our blood. This oxygen is what gives energy to every part of our body, from our muscles to our brain. And when we exhale, our body gets rid of wasted gases. This whole process is what we call respiration. And it has several steps, including breathing in. This is when air enters through our nose or mouth and travels down the windpipe into smaller airways in the lungs, reaching tiny air sacs called alveoli. Gas exchange in the lungs. These air sacs or alveoli are surrounded by tiny blood vessels, and oxygen moves from the air into our blood, and then carbon dioxide, once our oxygen is used, is exhaled. And then the blood brings it back to the lungs, and this is what we exhale. This process is repeated the whole time in order to keep us alive. Nevertheless, the ideal situation is that the air that we breathe in is not polluted. So what happens and what is in this air that is polluted usually, and how can it affect our health? Next slide, please.
In the air, there are many small particles that we are not able to see. And oftentimes it could be chemical, dust, or another very, very, very small particles. that could come from or through our nose or mouth and go to our lungs. These particles can be dangerous because it can really interfere with with the body defense and to the lungs. So it's very, very important to know what are the potential pollutants in the environment where we are and where do they come from. For instance, if we are in a space where there is agricultural activity, where there is there is farming, so maybe maybe some pesticide could be a pollutant. So if we want to take care of our respiratory health, we need to know the measures that we can take to protect our health. So so there are some of the particles that are called 2.1, 2.5 PM are the particulate matter is PM 2.5 are the very, very small particles that when we breathe them, they are in they come from different so they can cause inflammations and it also affect our health. So they are really small. We cannot see them. They are smaller than a grain of sand. But the next slide. So this particular matter that we've been talking about, this pollution that is in there, where does it come from? Let's go to the next slide. Let's go and research. So they could come from a different places. If we see it if we can see the slide, they come from industry emissions, exhaust fumes, and even smoke from burns. So if we think about it, I have I have a question for you. So these four sources of pollution and chemicals in the air, would you think that are you exposed to those sources in daily basis? You can share with us through the Q&A or the chat. Cindy Selling is yes, Mariana, Edna, Javier, Gloria. Yes, absolutely. And it's not necessarily we are outside every day, but however, we are exposed to all of those pollutants with some frequency. It could be that we go for a walk outdoors, or maybe because when we go from in the process of leaving home and getting on my car to go to work, I get exposed. And or maybe one day at work I have to to uh, to be part of an activity outdoors. So there are many reasons where we are exposed to pollutants, air pollutants on daily basis. And this topic is important not only for people who work outdoors, but for all of us. That despite that we're not exposed for a long time on daily basis, but we are continually exposed. And now that the summer approaches and the temperatures will continue rising, the will continue to rise, the risk of wildfires and climate change will also increase the risk. So this is something that we have to keep in mind, especially if you are in a place where wildfires usually occur. So when we think about how these particles, these chemicals affect my health, here you can see some of the more common symptoms. One of them is the affectation of the lung function. We can feel fatigue, talking, walking. For those people who suffer asthma, they will see that they will have an increase in asthma attacks and bronchitis, or related to the respiratory conditions. Also, people who have also heart conditions, the the the, the people who will be exposed to the air pollution could have irregular heartbeat, and even they could experience heart attacks due to this. And they could be existing conditions could worsen, like people who have immune conditions or cardiovascular disease. They could also experience some of this worsening of these conditions. Even if you don't have, if you're healthy, breathing polluted air every day can lead to long-term health issues. So it's very, very important. Our next topic, or next question, next slide. So what are some of prevention strategies to lower my exposure to chemical and air pollution? There are some measures that are very simple that you can take so you and your family protect from these particles and this pollution. Among this, we have, aside from these presentations, are all these detailed strategies in a table. The first of all is to review the local air quality in levels where you are located and see if they are high. We will go more into detail about this. And we will see how to research. You can also use respirators in case that there is a lot of air pollution. You can use an N95 respirator, so KN95, if you are going to be exposed in outdoors. If it's possible, stay indoors. If it's not possible, well, respirators is the best way to undertake your work or whatever you're going to do outdoors. Don't leave your car on. Leaving your car on can pollute the air. It can further pollute the air. Try to limit to avoid physical activity, especially near busy roads or highways where there are many many cars. That they will have very polluted air in those areas. So try to avoid those areas. Try to move your exercise near to areas away from these roads. In areas in the field, try to avoid areas where their burns are taking place. And then be aware if there is a program on burn. And impossible, try to do in if the quality of air is poor, choose indoor activities whenever it's possible, especially if we're talking about children, older adults, the elderly, or people with asthma or other chronic conditions like the cardiovascular diseases. And it's also important to remember that the school bus are also are sources of pollution. That is true. The kids are exposed in people who are close to the schools and the teachers, and whenever you are riding the bus, oftentimes, and the buses are also used in agricultural places, and those are vehicles that are source of many pollutants, especially if they are mm, if they are vehicles that are old or machinery that are old. So if it's old and still being used, it is more likely that the level of pollution is higher. And we can see here in the screen the exposure at work of PM 2.5. In this case, smoke from this machinery. This is another example. This is a worker at a factory inhaling smoke, probably chemicals or from machinery that is found in these places. And this is another example. Here we have a worker, and we can see that he's using a respirator, fortunately, but he is in a disaster zone. So this is also important to take into account when we're talking about responses to emergency and disaster. Air pollution during emergency and disaster is impacted not just for debris, which we see in the screen. We see a worker picking up debris in an area that was impacted by a phenomenon that destroy property, and we see dust. However, additional to the dust associated to this type of debris, especially if there is humidity, if there is rain, we will find mold. Next slide.
Mold is another pollutant that can affect our health. It grows in damp, warm places, like near to a window, to the ceiling, or the walls, and it spreads tiny particles into the air, tiny spores, and they are so little we cannot see them, but we can breathe them. And a long time, as we breathe them over and over, breathe them in, these tiny mold spores, they can irritate our lungs and cause health problems. So the effect would be even worse if we have any respiratory condition. Some of these symptoms may be coughing, or some symptoms that can be even worse. And very frequently, we try to clean with chemical products that tend to be strong as chloride and other kind of aerosols normally. And these products help stop the growth of mold, but they also spread out or release some gases or particles of these chemical products that can also produce an irritation, a headache, especially if we are using them in a small, poorly ventilated space and we do not have the right protection. So we need to be extra careful with mold as well as with the chemicals we use to clean. And also poor air quality inside or outdoors is happening especially because of this and also the weather and climate change. So to the extent climate change continues to advance and we see also storms, extreme rain, hurricanes, and other climate change happening, we see that the air that we breathe in continues to be affected. Next slide, please. It is necessary to speak about climate change when we speak about air quality because as the earth gets hotter with no control, our weather is more and more extreme. We have stronger storms, more frequent wildfires, and they are bigger, longer droughts, and intense heat waves. Many of these events don't just impact crops or buildings by mold development, but they also release more harmful particles and gases into the air, like ozone, which means it's probable that we are breathing in more pollution. Wildfires, for example, the smoke is not just smoke. These are toxic gases, ash, and fine particles that we breathe in into our lungs and can be really dangerous to everybody exposed. So it is important. Extreme heat will not only be affecting the environment, but it directly affects our body, our lungs, and our health. And the consequences are in the next slide, especially in the respiratory system. In the long term, we may develop some respiratory diseases. Here on the slide, we have some, such as silicosis, pulmonary emphysema, anemia, chronic bronchitis, or asthma. These are conditions that we can develop if we are exposed on an ongoing basis and frequently and during long times to this polluted air. That's why we're speaking about this, because they can worsen. The next question would be, how can we do about this? What can we tell our communities and our patients and the people surrounding us and my family, or what can I do to protect myself? Next slide. I share, Susana, your thought to keep on training people and sharing climate change with people. And with this, we need to add, how can we protect ourselves? Here we will be speaking about the air quality index. AQI is the acronym, and the respirators, which is one of the tools that we can use. Next slide, please. The air quality index that we mean is a little number when we speak about it, just as heat is a number that allows us to know if the air in my area where I am is good for me to breathe it in, or is it too polluted. I may know this way what is the status of the air, if it's right for me, or should I protect myself. And there are many categories that you can see on the screen. Air may be indexed as good, moderate, unhealthy for sensitive groups, who are the people who have respiratory conditions or heart conditions. And these first three categories go from 0 to 150. And these three first categories are normally considered safe, quite safe. The unhealthy for sensitive groups mean that those who have a respiratory condition need to protect themselves because they can stop presenting symptoms due to pollution in the air. Now, once we delve into the red ones, which is unhealthy, the purple one that is very unhealthy, and the brown one, which means hazardous, these are three categories where it is very recommended to use a respirator, to protect ourselves, anyone, a mask. So people, even if they do not have any condition or prior condition, they need to protect themselves when we have this air quality index, or remain inside, indoors, in their homes, and not expose unnecessarily. We can move on to the next slide. In order to find out how can we access to this information, we have several ways. Sometimes in the weather forecast or the weather report on weather itself, they provide us with this air quality index. Nevertheless, one way of having this information on constant basis at hand is this app that we recommend called Air Now. This is from the Environmental Protection Agency, or EPA, according to the acronym, and it can help you identify air quality right where you are with the GPS of your mobile. So it is very convenient, and we invite you to find it on your app store of your phone, and you can also scan the QR code on the screen. Next slide, please. After identifying the air quality index, if it's in harmful or hazardous areas, the recommendation is to use a respirator, an N95 or KN95. Nevertheless, it is extremely important that if we are going to use this mask, we use it correctly so that it is efficient. So we see here the instructions. First, pull the lower strap from the top to the lower back of the head, placing the strap under the ears. Then you need to pull the upper strap over your head to the upper back of the head, placing the strap on top of the ears, and making sure that is well adjusted to our face. And finally, we need to check the fit of the mask to make sure it's sealed and that we don't have any leaking of air. We need to make sure to inhale and exhale and observe if the mask sticks to us when we breathe in. If we see this is not happening, that we have a leak on the respirator, on the sides, it is important to adjust the straps and the nose piece, so that we need to make sure that the respirator creates a seal around our skin to make sure that the air that we're breathing, it's been filtered by the mask. Next slide, please. In this presentation, we are facilitating, we won't be showing the video, but for you to know, you will have access to a video that explains step by step how to carry out this process that we just mentioned, so that you can use this audiovisual resource with the audience that you're working with. Next slide, please. We have already spoken about the air quality and about using a respirator, N95 or KN95. Is essential when we speak of quality of air, but also we need to speak about how can we avoid to inhale these pollutants, how can we protect ourselves if they are coming out from mold spores and the chemicals used to fight against mold. These two respirators are ideal for this because they provide us with a protection to prevent the chemical exposure when we breathe, but it'll be very important that if you're working with mold or chemicals to control mold somewhere, this could be your home, work, wherever. It is important to read on the instructions tag of the chemical product that we will be using, because we need more things than just a respirator to work on a safe way with this. Normally, we are asked to protect our eyes. We have some goggles that we can use. We also need gloves to protect our skin and prevent direct contact, and also protective clothing. We don't want the chemical or mold to get to our clothes or skin or get in our eyes or respiratory system. We should try to find a way to avoid to inhale mold or the particles of the chemicals that we're using in order to control it. Very important to read the instructions in the product. Next slide, please. We have some recommendations that are specific for outdoor workers, especially those who work on the field, in agriculture. We always recommend that if you are outdoors, you always wear your PPE, the one that is right, the protection equipment, personal protection equipment for the job that you're doing. This will be very important to prevent respiratory health problems in the short or long terms. And wearing this equipment and essential protection measures include wearing a well-filtered N95 or KN95 mask when working specifically and especially in very dusty areas with chemicals such as pesticides, or when the place we're in, air quality here is poor or hazardous for our health. If you have any respiratory condition, it's probable that you would also need this additional protection. Also, wearing long-sleeve clothing, hats, and sunglasses to protect against sun exposure and airborne pollutants. Taking regular breaks in shaded or indoor areas to avoid prolonged exposure to heat and pollutants unnecessarily for a long time. And even when protective gear may be uncomfortable in hot weather, it is essential for long-term health. Next slide, please. So, this PPE will depend on the type of work that we do, the weather, and the air quality where we are. And here we have some examples of how we can protect ourselves. There are some protection mechanisms that protect a little bit more than others. For example, a scarf that we can place on our nose. Nevertheless, it won't filter all the particles that can maybe be filtered by a respirator, an N95 or KN95. Nevertheless, they can be useful to help us with some of the particles, maybe the bigger ones, but if we want to be totally protected from the very tiny particles that could actually get into our respiratory system and be harmful, the recommendation is an N95.
Next slide. Monica Bravo is bringing us a very important comment. She's saying something that we need to keep in mind is the labels of the products that we are using, even if it's just vinegar. That's right. We can also visit the manufacturer's websites to have more information in their website. Yes, I totally agree. Even if we are home, sometimes we use cleaning products without reading their labels. Oftentimes, because we use it in the way how our grandparents or taught us how to use it, but it is very important to educate ourselves regarding the labels in all chemical products that we use at home, in our workplace, because the label has very valuable information to for using the products correctly, and also to make sure that the products are effective, but also to protect our health while we're using the product. Thank you so much for your comment, Monica. And yes, it's something that is really important for agricultural workers that work that using pesticides that could be harmful if they are inhaled or if they are absorbed through the skin. So it is for these type of workers that work outdoors where the wind can also disperse the products that they are applying, so they are a higher risk to breathe it. So for them it's crucial the question of PE. Something that we need to keep in mind is that often we avoid use PE because we feel that it could delay our work, that that our output will be lower. But it is important to remember that if we get sick, we're not going to be able to work as we need it, and it's going to be hard to support ourselves, but also to support our family that count on us in this process of care. So it's very important to protect ourselves, take care of our health to make sure that we can continue with our work. Next slide. So this is a summary of the recommendations, and in the chat with Richard says that at work the employer needs to provide the labels, training, and much more. Yes, and now we have our colleague Miss Alma Garban. She's going to be introduce you with a comic book so you can see some of the materials that we're offering today. Thank you so much, Mireles. Thank you so much for showing this. So what Mireles has been showing us is part of a team to a set of materials, which is this PowerPoint, along with a guide on how to use this PowerPoint, and also a comic book. Next. So this comic book, you saw all the slides are related to this comic book. It's called Nobody Knows What is Written Until it needs more air. So as you know, we develop these materials so they are appropriate and effective, and that are also connected with people's reality, that they can into account what is value, what is important. That also introduces practical options and also related to concrete situations. That's what we were where we're trying to do with this comic book. We came with a team. Many of them review it. Even some of you who are here were part of the focal group where we tested this material. It took us about between 6 and 8 months to develop this this comic book. So due to the lack of time, I will go very quickly through this comic book. So it's a story that takes place in a laundromat where people who work there come to wash, to do their laundry, and they are complaining about the heat, and they are talking, and they realize that they are struggling to breathe, and they start reflecting about the chemicals and what it is in the air that we're breathing. Next one is Martha. So in the comic book, you see all the sources of pollution, the PM 2.5, where it comes from, and how can affect our health, and also the prevention strategies that you saw with Mireles. In the comic book, you can also see the air quality index and how climate change is impacting the air that we breathe, and how an N95 respirator or a N95 respirators can be used. It talks about how we can protect ourselves, especially when you are removing mold, or also, as it was mentioned, one of the participants was mentioned as how to read the label, and also the PPE, the recommended PPE along with the information sheet. It also addresses all the PPE required, and as well as the respiratory diseases that could that could be due to the exposure, yes, or either chronic or a single exposures, and also the impact, not only medical but social, and finally, it gives you the option for the pre for to the person who's using the comic book to remember the main topics and how this can be used. Next one. So part of this material, this comic book that you will be able to download and print, and the guide that tell us step by step how can we use this presentation, and also you will have the support if you require in case that is needed. Remember that this guide, the facilitator guide, and what Mirelis show us is the content that is the key elements that you can that you can use, but you can adapt it, and you can add, or you can take things out, and making as participatory as you want. And Mireles did some, and you also know. So we invite you to download it, uh, and even also there is an element in the comic guide where you can include your logo, and you can make this presentation yours. All these materials are free for use. As you know, is the objective is to educate, to give information, and to give the tools so people can make the right decisions. We cannot make the people to protect themselves, but we can give the information, there's tools, so people can protect themselves. That's our work. So the only thing that we require from you is that when you use this in a different way or in a way that it is adapted to the group that you're working with, let us know, because that's interesting how the material is born that way and it starts growing and is being used and implemented. And this is something that we should be documenting. That's what we're trying to do. So next one. So with this, I don't know if there is time for questions, but if you have any doubts, any questions, any suggestions, please write to us. And most of you have our contact information. If not, we will put it in the chat. Please help us to answer in this evaluation. This is really important for us to know if the materials that we're developing are answering your needs and also the communities that you serve. So please take a minute, take your phone and with this QR and answer this survey. Anything else, Mireille? Yes, in the chat there are also links to download the materials and also the link for the evaluation. And please, we ask you to go to the link and to let us know what you think about this presentation. What do you think about the materials and which other materials are missing? This is very important for us for continue creating resources that that can be used by you, and while we are here always available. One final thing before finishing. Remember that all these materials, the comic book, you can use them in a health fair, in a talk, in a home visit. The way that you imagine you can use it. It is directed to a family in general, so you can use it. You can use it with a with a child, with a teenager, and or with a worker, and it's being written in a very simple way. Please share with us how you can be used and make it yours. And thank you for participating in this effort to pass information to the communities that really need it. Thank you so much also to our interpreters for the amazing service. Thank you. Yes. And Marta, if you go to the last one, you can see all the ways how you can get in touch with us in all the social media. You can access to our resources in our website. Thank you so much and have a good afternoon. Thank you. Have a good day.